Hello, everyone, and welcome to another episode of Arthritis at Home. On this special episode, we are focusing on EULAR 2022, which is the coming together of arthritis health providers from around the world in Europe every June, upwards of 18,000 of them who are presenting the latest research on the diagnosis, prevention, treatment, and management of arthritis. And at this year's meeting in June, ACE was present along with other members of the Global RA Network, which was co-founded by ACE in 2016, along with other rheumatoid arthritis patient organizations and leaders from, I think it was almost 18 countries. And it was formed to build international relationships, collaboration, and to work on common goals and initiatives, particularly around models of care for rheumatoid arthritis. At this year's meeting of the Global RA Network, ACE led a one-day workshop, and it was centered on a couple of initiatives. And Cheryl, I'm hoping that you can describe to us what some of this work was.
Hi, Kelly. Great to be here again. Yeah, I think I have a smile on my face because these are our international brothers and sisters in rheumatoid arthritis. Education, information delivery, but very importantly, advocacy. And as you know, Kelly, we linked arms back in 2016 and have remained a really steadfast group of brothers and sisters in arms, working on behalf of the people in our countries who are living with rheumatoid arthritis in particular. And our founding came about based on a very large international survey that we presented at the 2017 American College of Rheumatology meeting. It actually was one of the darling posters that year, and there was a lot of buzz around it because it was the largest crowdsourced survey ever presented, I think, at the meeting, and likely has been surpassed by now in 2022, but was very, very important because it was very specific to models of care. And we know that there are, 5 sort of waypoints or, flag posts along that journey of care. And that's awareness of signs and symptoms, diagnosis, like referral and diagnosis, medical management. So what is the health professional who diagnosed you going to help you do to control your disease? For shared care, meaning you're part of a team that is sharing the different aspects of the care that are required to help someone be their whole person, to live their best life. And then, of course, self-care. So the things that I do at the very kind of end of that pathway to live my best life. And it's a learning curve all along the way. And that is true for policymakers as well, who really don't know that models of care exist, Kelly. And so that was why we undertook the survey to begin with, was to find out, well, where do models of care exist? Where do they not? Are they partially there? Are they not there at all? And what do they look like? And so we began working over the last year with the membership to take the data that we gathered to found the network and to put it into a visual tool. There's enough, picture tells 1,000 words, isn't that the saying? So we thought we would make it really easy for policymakers by creating a dashboard, basically a counter of data in each of the countries about what's happening to people living with rheumatoid arthritis. And in some instances, we're using global arthritis stats as well. So we launched this dashboard at the European meeting. We held this workshop. We identified together ways that we were going to use this dashboard to further our advocacy mission and our education mission.
And what
It was pretty
countries
well
were
received.
represented? When you talk about the 18 members, what kind of representation is that?
Well, they're from the Americas, so Canada, the US, Brazil, Colombia, Chile. So not all of them, but we continue to grow. And then in Europe, we're talking about Romania, we're talking about the United Kingdom, France, Spain, Italy, the Netherlands. So really a lot of the countries in Europe where RA patient organizations exist, or where arthritis organizations exist and have a very strong focus on rheumatoid arthritis.
And obviously, those dashboards would be an incredible way to show the disparity, not just care within a country, but between countries as different as the ones that you just described.
Exactly. And there are definitely haves and have not countries. And we've known that for a long, long time, Kelly. There are some patient organizations in some countries that are well resourced, therefore have a strong presence in the community and as well at government. And there are some who don't at all. And so this is really about leveling the field in rheumatoid arthritis around the world. It is to ensure that we are closing the inequity gaps, right? And working towards equity, which is a really big part of our mission here at ACE, as you know.
What were some of the key learnings that were pictured on the dashboards?
Well, key learnings were plenty. And sadly, Kelly, they were really about the fact that data it doesn't exist, frankly. Or if it exists, governments won't give it to us, which is shocking. Researchers have this saying, if you can't count it, you can't fix it. Especially researchers who work at population health level. And that's absolutely true. That is a truism. If you can't quantify the problem, how in the world are you going to go about fixing it? So how are you going to deliver on models of care if you don't even know how many people with RA are living in the country, being served by that healthcare system? Or if you know, but you won't give it to the very people with the skills to help those people, you have a big problem. And that often is the case. Sometimes patient organizations don't have good allyship with the clinical community in a country. So that was another thing we learned. There are gaps in relationships. And one of the things we know is that, patients and patient organizations, associations, working closely, independently, but closely with clinical communities like rheumatologists, like rheumatology researchers, lifts everybody's game, right? We all benefit from that developed and strengthened relationship. So we learned that, which I found really a profound learning.
Okay.
Yeah.
So when we meet with elected officials and policymakers across Canada in every province and territory, one of our key messages is that there is no standardized RA model of care that exists today in Canada or any of those jurisdictions. Is the same true for the Americas and Europe?
Well, I would say, just on the point you just made about there being no standardized, nationally speaking, there is no standardized model of care for rheumatoid arthritis. That's a true statement. But you would have people who work in the healthcare system, provincially, territorially, who would say, oh no, we have a model of care. The model of care has holes in it, right? It's not a true model of care such as you have almost universally in cancer in Canada, for example. And it's okay if these models of care look slightly different from province to province, because as we know, Kelly, healthcare is delivered at the provincial level. They get one check from the federal government, and each province and territory gets to decide, based on its population needs, based on geography and population distribution, how it spends the money. Advocates like us are okay with that. We're not okay with them developing a model of care that is not informed by what the model of care should look like, right? We have evidence that tells us what people need in those 5 quadrants I spoke about at the very beginning of this conversation. We know what should be provided at each of those stages. We know when, we know how, we know why, and we know what cost, or at no cost in some cases, Kelly. But if you, so in the sense that you're saying there is no standardized model of care, that's true nationally. It's largely true when you look at the provinces as well, because each one has a gap. And that is true in our brother and sister countries in the network, for sure. In some countries, it's a complete, you know, it's tragic, actually, is the only word I can conjure up here, that there is really no model of care. It's about someone like me individually just fighting in the trenches to get a diagnosis. And then what? Oh, there's no rheumatologist for me to go to in this community. Oh, well, I better get myself 100 kilometers down the road, right? So in the countries that I've talked about that are halves, we don't, like, I don't even think about that, Kelly. My rheumatologist is 3 kilometers away from me. But we have people living in the same province I'm living in who have to travel 600 kilometers. So the model of care for them, that experience, is significantly different, right? Yeah.
So if people who are looking for or interested in getting more information either about the Global RA Network or about the work that's doing, or about these RA dashboards, where can they go?
Yeah, so first stop is the website. It's sort of the hub of all of our activities and the tools that we've developed over these last 6 years. And we're going to give the link at the end. It's globalranetwork.org. And it's a really straightforward site, super easy to navigate, mobile friendly, so okay to use on your phone and your iPad and also your desktop. And we encourage people to go to the dashboard itself. You'll find it on the menu when you get to the website. It's very clearly laid out there under RA models of care. It just says RA dashboard. So a couple of things people can do no matter what country they're in. And by the way, this site is translated into all of the member country languages as well as English. So if English isn't your preferred language, you will find your own language, first language there. People should hop on Twitter and follow at Global RA Network. They should use the hashtag RA Dashboard in their social media posts. They should use this site and email it in a letter to their local elected official, to their provincial, federal official, because by sharing the information that's on this website, and there's a treasure trove of information, they're helping to educate the very people who are charged with planning policy to meet our needs. And no one patient organization, not ACE, not any one of our members, can do it by ourselves. Our strength is in the brotherhood and sisterhood. I say this all the time. It is between individual patients and small groups of patients or people living with RA out in the community. We are the village of people who have to drive the advocacy and awareness of the need for RA models of care in our local communities, in our regional communities, provincial communities, state communities, as well as national or federal communities. So those are a couple of things that people can do. Go read, learn, and activate yourself. It's easy to become an advocate, and you don't have to go on TV. You don't have to write to the newspaper. You simply have to share the information that's on the website. Frankly, it's super easy, and engage on social media with us would be fantastic.
A great message and a great way to conclude this part 2 of our special EULAR episode. Cheryl, thanks so much for spending time with us today and talking about the Global RA Network.
Thank you.
And thank you to all our viewers and listeners. We will be reporting back from the American College of Rheumatology annual meeting in November, the other major annual meeting in the arthritis world. So look forward to that update in the fall. And thank you again for joining us here at Arthritis at Home.
Bye, everyone.